My name is Paige Evans, and I have schizophrenia. For many years, I've struggled with the feeling that there's something wrong with me, something that made me different from others, and I tried my best to hide these differences. You would think that identifying and treating my schizophrenia would be the largest challenge that I would face, but that is not the whole story. The mental health stigma that exists in our country is an additional barrier faced by me and other people with mental illnesses. So what is mental health stigma? Webster's dictionary defines stigma as a mark of shame or discredit. In relation to mental health, you can break down the stigma into 5 categories. The first is self-stigma. So self-stigma is the way a person views him or herself and how it is negatively impacted by other people's negative views. So they take those negative views and they internalize them. So this results in lower self-image and lower self-esteem. The second is help-seeking stigma. So this is the stigma attached to seeking help for your mental illness. The stigma often prevents a person from seeking help for their illness at all. The third is associative stigma. So this stigma is experienced by family or friends of the person with mental illness. The fourth is public or cultural stigma. So this is just the way society reacts to mental illness. The fifth is anticipated stigma. So this is the worry or belief that if you share your diagnosis with others, that stigma will arise. This type of stigma often prevents someone from sharing their diagnosis with others at all. So they non-disclose, they keep it to themselves. I've experienced all 5 of these types of stigmas in my life. And the fear of what other people thought of me kept me from seeking help that I needed for many years. When I was a teenager, I tried to tell my mother about some of my symptoms, but she brushed me off, telling me I was just tired and I needed to go to bed early. When I was in college, I started having hallucinations. They interfered with my ability to concentrate, to get work done, and even take tests. I felt like a failure and I fell into a deep depression. My roommate tried to talk to me, but I was worried that if I shared the details of my struggles, she would treat me differently. That fear also applied to my dating life. I would meet a guy and I'd really like him, but my fear would cause me to push him away. The one time that I allowed myself to get close to a guy and tell him about my hallucinations, he called me crazy and a nut job, and he never called me again. During my senior year of college, the culture on campus shifted from a high level of stigma to that of openness and less judgment. I finally gathered my courage and went to speak to a doctor at the Student Health Center. Fortunately, he listened to my concerns, and he referred me to a psychiatrist who then prescribed me antipsychotic medication and psychotherapy. Yay! However, for several years, I fought with my insurance company over the number of treatments they would cover, as well as the reimbursements they offered for my medications. Because of parity laws passed in 2008, my insurance provider is now required to treat my mental health problems the same as they would any physical health problem, and I now have more consistent coverage for my medication and therapy. Last April, I fell and I hit my head and went to the emergency room. As the ER doctor and I were talking, he asked about the medications I was taking, and I mentioned my antipsychotic medications. After that, I could sense a shift in the way he treated me. It was almost like he stopped viewing me as a person and then started worrying about what I might do. Unfortunately, the mental health stigma exists within the medical field, where some providers still view patients with mental illnesses as dangerous, unpredictable, or unstable. Also, the self-stigma associated with mental health may prevent medical professionals, even those who work in the mental health field, from seeking support for themselves. My struggles have not been confined to the medical and insurance arenas. I want to work, but finding a job that will accommodate my illness is challenging. The thought of disclosing my schizophrenia to a potential employer causes a great deal of anxiety, even now. On one hand, my schizophrenia is none of my employer's business. However, I need to structure my day in such a way to avoid triggers, and that requires my supervisor's involvement. Ultimately, I need to work to maintain my health insurance and to give myself a sense of purpose, so I'm willing to have these conversations with potential employers. It seems as though the general public still views people with mental illnesses as anything from a burden on society to just dangerous. Approximately 1/4 of the homeless population are veterans who may suffer from PTSD, depression, and other mental health concerns. The suicide rate in the veteran community is approximately 22 deaths per day. Many of these individuals have trouble accessing mental health care due to shortages of providers and inadequate funding. The mental health stigma can impact society on a lot of different levels, including lawmaking and funding. If mental health is not prioritized by citizens and subsequently government leaders, then we will see a decrease in support for laws that protect the rights of citizens with mental illnesses and standardization of healthcare and insurance programs. We will also see a decrease in financial support for community programs. These community programs range from mental health centers to halfway houses, but are often grossly underfunded and really can only target those with lesser mental health needs. A shift in society's perspective and the elimination of mental health stigma are crucial to normalizing mental health treatment and care. The first way to combat mental health stigma is to do what I'm doing right now. Talk about it. We can engage in discussion about our treatments, our struggles, and how we are more than just our diagnoses. By sharing our stories, we will find that we are not as alone as we thought, and we may even help someone without even realizing it. Another way to eliminate mental health stigma is to change our vocabulary and language involving mental health. For example, refrain from using the words crazy, psycho, paranoid to describe others. Don't label your behaviors as OCD, addicted, or bipolar. Stop saying something makes you want to kill yourself. By using such language, you are discrediting those people who actually have mental health issues, and you are contributing to the overall mental health stigma. Additionally, we must take the initiative to politely intervene when we hear rude comments about mental illnesses or conversations that are inappropriate. We need to treat those interactions as an opportunity to help shift others' mentality and self-stigmas. The media is playing a role in perpetuating the mental health stigma as well, from their approach to coverage of mass shootings to TV shows that inaccurately portray mental health illnesses. We can change the mental health stigma by holding the media accountable and contacting those organizations. Finally, in order to eliminate mental health stigma, we must eliminate our own self-stigma. We must actively reject the negative attitudes of others and view our mental illnesses as equal to physical illness, worthy of care, treatment, medication, and compassion. If we learn to accept our mental illnesses, then we can serve as an example for how society must accept them as well. Thank you so much for your time.